Hello, and welcome to Medical Specialists Associates Educational Series on topics in critical care medicine. I'm Christopher Voss, MD, MS, FCCP, board-certified in anesthesiology, critical care medicine, and neurocritical care medicine. Lactate levels are a crucial biomarker in the management of sepsis, offering insights into the severity of the condition and helping guide therapeutic interventions. Elevated lactate levels are associated with tissue hypoperfusion and metabolic stress, making them a key indicator in both the diagnosis and prognosis of sepsis. This summary integrates the latest research findings with the current recommendations from the Surviving Sepsis Campaign guidelines. Different ranges of lactate levels have distinct clinical implications. Normal lactate levels, 0 to 2 millimoles per liter. These levels are typically seen in healthy individuals and are associated with better outcomes in septic patients. Mortality rates are generally lower, around 15%, in sepsis patients with lactate levels below 2 millimoles per liter. Intermediate lactate levels, 2 to 4 millimoles per liter. These levels suggest a degree of tissue hypoperfusion and carry an increased risk of mortality, approximately 25%. This group requires careful monitoring and potentially more aggressive intervention. High lactate levels, greater than or equal to 4 millimoles per liter. Levels at or above 4 millimoles per liter are strongly associated with severe sepsis or septic shock, with mortality rates exceeding 40 to 50%. These levels are used as a critical threshold for initiating early, aggressive resuscitation protocols. Monitoring and timing of lactate measurements. Initial measurement. The Surviving Sepsis Campaign recommends that lactate levels be measured as soon as sepsis is suspected, ideally within the first hour of presentation. This early measurement helps assess the severity of the condition and guides immediate treatment decisions. Subsequent monitoring. Within the first 6 hours. The guidelines recommend repeating lactate measurements within the first 6 hours after the initial measurement, especially if the initial lactate level is elevated, greater than or equal to 2 millimoles per liter. This frequent monitoring is crucial for assessing the effectiveness of resuscitation efforts and guiding ongoing treatment. Every 24 hours. After the initial intensive monitoring, lactate levels should continue to be measured at least every 24 hours to monitor the effectiveness of treatment. Persistent elevation or lack of lactate clearance is associated with poor outcomes and may indicate the need for more intensive interventions. Beyond 24 hours, continued lactate monitoring is essential, particularly in patients with initially high lactate levels. Successful lactate clearance within the first 24 to 48 hours is associated with improved outcomes. Mortality associations and lactate levels. Lactate less than 2 millimoles per liter. Patients with lactate levels below 2 millimoles per liter generally have lower mortality rates, around 15%. These patients are typically at a lower risk of severe complications and require standard monitoring. Lactate 2 to 3.9 millimoles per liter. Mortality increases to approximately 25% for patients in this range. These patients are at higher risk and should be monitored closely, with interventions adjusted based on lactate trends. Lactate greater than or equal to 4 millimoles per liter. A lactate level of 4 millimoles per liter or higher is associated with significantly higher mortality rates, often exceeding 40 to 50%. This threshold is used in clinical practice to trigger aggressive resuscitation and close monitoring. Recommendations from the Surviving Sepsis Guidelines. The Surviving Sepsis Campaign highlights the importance of lactate measurement in the early identification and management of sepsis. Early measurement. Lactate levels should be measured within 1 hour of sepsis recognition to help stratify the severity of the condition and guide resuscitation efforts. Lactate-guided resuscitation. For patients with elevated lactate levels, greater than or equal to 4 millimoles per liter, resuscitation efforts should focus on reducing lactate levels, with the goal of achieving a clearance of at least 10% within the first 6 hours. Continued monitoring. Serial lactate measurements are recommended, particularly within the first 6 hours, to guide ongoing treatment decisions. The guidelines emphasize that lactate clearance is a key indicator of patient response to therapy and should be used alongside other clinical markers to adjust treatment strategies. Conclusion. Lactate is a powerful biomarker in the management of sepsis, providing critical information about patient prognosis and guiding treatment decisions. The integration of lactate measurements into sepsis management protocols, as recommended by the Surviving Sepsis campaign, underscores its importance in improving patient outcomes. Regular monitoring, particularly within the first 6 hours, and timely interventions based on lactate levels can significantly influence the course of treatment and reduce mortality in septic patients.